Hypertension affects over 70% of adults past 65, but 10 common foods can measurably bring those numbers down. From familiar staples that trim a few points off your reading to one that drops blood pressure by 10 millimeters of mercury in hours, this countdown ranks them all by proven clinical impact. Which food earned the top spot? Let's start with number 10, a creamy staple already in your fridge. In the 10th place, plain low-fat yogurt offers a simple way to support healthy blood pressure. Just 1 cup a day delivers a mix of calcium, potassium, and live probiotic cultures that work together to relax blood vessels and help the body balance sodium. Clinical studies in adults over 60 show a modest drop in systolic pressure, typically between 2 and 5 millimeters of mercury, after 6 to 12 weeks of regular yogurt consumption. For best results, choose unsweetened varieties with active cultures. Those with lactose intolerance can try Greek-style or lactose-free options. Watch for added sugars, which can counteract benefits. The DASH diet recommends 2 to 3 servings of low-fat dairy daily, making yogurt an easy, snackable heart helper for older adults. Number 9. Avocado brings heart-healthy fat to the table, helping arteries stay flexible and supporting better cholesterol numbers. Just half a medium avocado delivers about 485 milligrams of potassium and a generous dose of monounsaturated fat, both linked to a drop of 2 to 4 millimeters in systolic blood pressure over 4 to 8 weeks in small clinical studies. Swapping a salty snack for avocado toast or adding slices to a salad can make meals more filling while trimming saturated fat. For those watching calories, stick to a half avocado serving daily. People on potassium-sparing medications should check with their doctor before increasing intake. In 8th place, garlic delivers a blood pressure drop that rivals some medications. The secret lies in allicin, a sulfur compound released when garlic is chopped or crushed. Allicin blocks the same enzyme targeted by ACE inhibitor drugs, relaxing blood vessels and reducing pressure inside the arteries. Meta-analyses show that 1 to 2 raw cloves a day, or a 300 milligram aged extract supplement, can lower systolic blood pressure by 3 to 8 millimeters of mercury, with effects often visible by week 4. For older adults on blood thinners or anticoagulants, it is wise to limit raw garlic to 2 cloves daily, as higher doses may increase bleeding risk. Cooking garlic can reduce its potency, so for the full benefit, fresh is best. Garlic's measurable, drug-like impact makes it a standout among herbs, but safety comes first for those managing multiple medications. Number 7. A handful of unsalted mixed nuts and seeds offers a practical snack swap that supports steady blood pressure. Just 30 grams, a small palmful, delivers about 70 milligrams of magnesium and a healthy dose of the amino acid, arginine, both known to help relax the smooth muscle in artery walls. Meta-analyses of more than 30 randomized trials show a clear pattern. Every 10 grams of nuts consumed daily brings about a half-point drop in systolic pressure, so the standard 30-gram serving can lower systolic blood pressure by up to 2 millimeters of mercury over time. Swapping salty chips or crackers for unsalted nuts cuts sodium intake while boosting satiety, making it easier to stick to heart-healthy habits. With about 160 calories per serving, portion control is key, especially for those watching weight. For maximum benefit, choose unsalted varieties and keep servings moderate. Number 6. Beans and lentils serve as a practical, budget-friendly way to lower blood pressure while anchoring main meals. Just half a cup of cooked legumes, such as black beans, chickpeas, or red lentils, delivers about 405 milligrams of potassium and 7 grams of fiber, helping the body flush out excess sodium and promoting a lasting sense of fullness. To minimize digestive discomfort, rinse canned beans thoroughly and gradually increase intake. Randomized trials in adults over 50 show that adding beans or lentils to meals 3 to 5 times a week can lower systolic blood pressure by 3 to 6 millimeters of mercury within 12 weeks. Swapping out processed meats for bean-based chili, lentil soup, or chickpea salads not only cuts sodium, but also supports heart health on a tight food budget. For those with chronic kidney disease or on potassium-sparing medications, it is important to monitor potassium levels with a clinician. Number 5. OATS offer a simple breakfast routine with a measurable impact on blood pressure. Just half a cup of dry oats, which becomes about 1 cup cooked, provides 3 grams of beta-glucan-soluble fiber, the key ingredient that binds bile acids and lowers LDL cholesterol. This action helps keep arteries elastic, a critical factor for older adults facing age-related stiffening. Clinical trials in people over 50 show that eating oats daily can lower systolic blood pressure by 2 to 5 millimeters of mercury in as little as 8 weeks. Oats are naturally gluten-free if certified, making them accessible for most diets. Stirring in a handful of berries or a sprinkle of cinnamon keeps breakfast interesting while adding antioxidants. Whether served as hot oatmeal, overnight oats, or blended into smoothies, oats fit easily into the morning routine and set the stage for heart-healthy toppings. Number 4, berries offer a colorful shield for the arteries, thanks to their rich supply of anthocyanins and vitamin C. Just half a cup of blueberries or strawberries, enjoyed several times a week, delivers enough flavonoids to help guard the delicate lining of blood vessels from oxidative stress. These compounds boost the body's own nitric oxide, relaxing vessel walls and improving blood flow. In an 8-week clinical trial with adults over 50, daily blueberry intake lowered systolic blood pressure by 5 millimeters of mercury. This result is on par with some first-line medications. Berries also improve flow-mediated dilation, a key sign of healthier arteries. They are easy to add to oatmeal, blend into smoothies, or snack on straight from the freezer, making them a practical and affordable way to sweeten meals while supporting heart health. Frozen options keep costs down and nutrients intact, making regular berry consumption possible year-round. Coming to the top 3, fatty fish like salmon and sardines deliver a powerful anti-inflammatory effect that directly targets blood pressure. A typical serving, about 120 to 150 grams, 2 to 3 times a week, provides long-chain omega-3 fatty acids, EPA and DHA, which embed in cell membranes and help calm the chronic inflammation that stiffens arteries with age. Clinical trials in adults over 50 show that swapping red meat dinners for fatty fish can lower systolic pressure by 4 to 7 millimeters of mercury, with added benefits for arterial flexibility. EPA and DHA also boost nitric oxide production, further relaxing blood vessels and improving flow. For those concerned about mercury, salmon and sardines are both low mercury options, and canned sardines offer an affordable, shelf-stable choice. Studies consistently find that regular fish meals, not supplements, bring the greatest benefit. While the evidence for fatty fish is strong, the need for meal planning and higher cost compared to plant-based swaps keeps it just below the top 2. In second place, leafy greens like spinach, kale, and Swiss chard deliver a powerful potassium boost that helps the body flush out excess sodium, a process known as natriuresis. For adults over 50, even a single cup of raw spinach or kale each day supplies more than 540 milligrams of potassium, enough to counteract the age-related tendency to retain salt and stiffen blood vessels. Randomized trials in older adults show that this simple habit can lower systolic blood pressure by 3 to 6 millimeters of mercury, a meaningful drop for anyone managing hypertension. These greens are easy to work into daily meals. Toss a handful into morning smoothies, layer them into sandwiches, or serve as a salad base. For those taking ACE inhibitors, ARB medications, or potassium-sparing diuretics, it is wise to monitor potassium intake with a healthcare provider. The evidence is clear. Regular leafy greens offer a safe, affordable way to support healthy blood pressure, especially in salt-sensitive seniors. And finally, in first place, beets stand out as the fastest and most powerful food-based way to lower blood pressure. The secret lies in their rich supply of dietary nitrate, which the body converts through a unique enterosalivary pathway into nitric oxide. This molecule acts as a natural vasodilator, relaxing artery walls and triggering a rapid drop in systolic pressure. A single serving, like 250 milliliters of beet juice or half a cup of roasted beets, delivers about 300 milligrams of nitrate, enough to lower systolic blood pressure by 4 to 8 millimeters of mercury within just a few hours. For lasting benefits, regular intake maintains a chronic reduction of 4 to 6 points. Clinical trials in adults over 60 confirm these effects, with both juice and whole beets producing sustained improvements over 12 weeks. However, the nitrate to nitrite conversion depends on healthy oral bacteria, so antiseptic mouthwashes or recent antibiotic use can block the benefit entirely. To maximize results, avoid strong mouthwash for at least 12 hours before and after consuming beets. Most people should limit beet juice to 1 cup per day, staying under the accepted daily intake of 3.7 milligrams per kilogram of body weight. For those on blood pressure medications or with a history of low blood pressure, it's wise to monitor readings and consult a clinician before starting high nitrate regimens. With the largest and quickest impact on systolic blood pressure, beets earn their place at the top of the list for natural, food-based blood pressure control. Across all 10 foods, one pattern stands out. Nutrition is powerful medicine. These everyday choices actively counteract the effects of aging arteries, helping millions reduce risk without prescriptions. For anyone over 50, what is on your plate is not just a meal, it is a daily investment in your heart's future.